that she'll be here in a little while, but we are going to get started. So if everyone will just rise for the pledge to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right. So Tim is not here tonight. Tim is homesick, and he's got Steve here taping the meeting. And Steve, if I could also ask you, if there are any things that come up that we need to ask Tim to do, you can just take some notes and sort of let him know. And since Tim's not here, this is our chance to give Tim lots of homework, right? The person that can't make the meeting gets the homework. We have two members excused tonight. Lynn Kane is not going to be here, and Brian Wood is not going to be here, and Tim Rapley as well.
Hey Steve.
Yeah.
Just one more. Steve Ricardo emailed Tim and I this afternoon.
Okay, and Steve Ricardo. Okay, so all right. I would like to start with introducing our newest member, and we're very excited to have you on board. And is it Dr. Charles Walsh?
No,
Just Charles Walsh.
Yep.
Probably got lots of letters after you too, but Dr.
I
Walsh.
had one on TV.
Okay, and did I pronounce it correctly?
Pardon?
Did I pronounce your last name correctly?
Yes.
Okay, so Dr. Wells comes to us from the Albany County Health Department as part of our opportunity to diversify ourselves beyond the EMS community. We thought it would be wonderful to have somebody from the public health community join the council. So we look forward to your input. We look forward to learning from you on some things that perhaps we can become better at, and not only talk about EMS issues in isolation as they affect EMS, but also as they affect public health. So if you would like to just tell us a little bit about yourself, that'd be great.
Sure, I've been, my position at the County Department of Health is Director of Public Health Planning and Education. I've been at the County Health Department for 16 years, starting with actually initiating our preparedness program. I have an MBA in Healthcare Administration, and these days our focus is trying to deal with opioid use disorder. And so I've been working with Tim and Brian Wood and the county executive's office to try and get more communities to adopt ODMAP as a way of tracking overdoses in the community. I can also share what select counties contiguous to Albany are doing with the state health department in terms of their initiatives and how they can integrate with Remo. We're also my portfolio includes injury prevention and also chronic disease prevention. So we actually worked with Remo years ago and the Heart Association to advance hands-only CPR training among EMS squads. So your work's really important and key in terms of not only responding to people in need, but there's an opportunity for us to share communications with the public, so there's a consistent messaging. So I'm not only here to represent the Albany County Department of Health, but also potentially represent some of the activities that are occurring in Rensselaer, Schenectady, Saratoga, and all the counties, Columbia, Greene counties, and others that are represented by Remo.
Great. Well, thank you very much. Would it help if we introduced ourselves to you? Just went around the room since why don't we do that? So start with Anne Marie.
I'm Anne Marie Cross. I am the vice chair of the Remo Council.
And why don't you everyone just say what brings them here? So what your role is.
I'm also affiliated with Saratoga Hospital. I'm the director of the emergency department.
I'm Steve Kroll, and my affiliation is I'm the chief of Delmar Bethlehem EMS, which is the ambulance service in the town of Bethlehem.
Ron McHugh, I'm the chair of the REMAC and the chair of Ellison Retreat.
Tracy Ware, I'm the chief of operations for Water Rescue Squad in Saratoga County on the board.
As you know, Scott Bowen from the Sheriff's Office. I'm an at-large member, though I don't represent the Sheriff's Office necessarily.
Kathy Allen. I'm with North Greenbush Ambulance and Remsco County EMS Coordinator.
Jim Steers, I'm an at-large member. My only current affiliation from an EMS perspective is with the National Ski Patrol, but I have about 4 years as an EMS provider in the Remo region.
Steve Retzlaff, at-large member also from Empire Ambulance.
AJ Keeler, Columbia County EMS Coordinator.
Carol Brandt, I'm with Mohawk Ambulance.
Jeff Williams, I'm with Mohawk.
Dave Massaro, Captain of Schenectady Fire.
Jim Donna, Captain of Niskuna Fire and representing Schenectady County EMS Council.
Mike Daly, Remo Medical Director.
All right.
Thank you, Charles.
All right, thanks. Well, it's great to have you here, and how many people here are using OD map, just out of curiosity? All right, so some of us are, but not all. Maybe one of the things we could ask you to do at a future meeting is to talk a little about the opioid use disorder strategy. I imagine even though you represent one county, you can talk about it from a perspective of all the counties in the capital district working together, since we're a 6-county organization. That might be a great opportunity just sometime in the future, so we'll work on that with you. All right, thank you. So first thing we need to do at the calling the meeting to order is approve the minutes from the last meeting. Tim did send the minutes out. Are there any corrections to the minutes? All right, and can we have a motion to approve the minutes of last meeting?
So moved.
Second? Seconded? All right, any discussion? All right, all in favor? Any opposed? Any abstentions? The minutes are approved. All right, so I'm gonna do the, Tim did write out his executive director's report, but I'll just cover some of the things for you. The awards banquet was very nice and it did go well. We were very grateful to St. Peter's Health Partners for sponsoring it. It was a little bit, they dressed up the affair a little bit compared to some of our past banquets, so we're grateful. Michael Finnegan, who is the new CEO of St. Peter's Hospital, did come and stay for the whole banquet. He spoke for a couple of minutes, but he also got out in the crowd and was talking with people. He has expressed an interest to do some ride-alongs with some agencies, and I think he got about 10 invitations that night, so perhaps that would be great having him do ride-alongs. The other really nice thing is St. Peter's Health Partners is going to be having all of their new emergency department nurses when they start. I don't know if this will cover the agency nurses, but their new employed nurses, they're going to be doing ambulance ride-alongs for one day to get a sense of what life is for an EMS provider. They actually approached Delmar Bethlehem EMS about doing it, and we agreed to do it. Just so happens one of our officers is married to an ER nurse who got involved in the discussion. So there'll be a nice perspective, I hope, that some of the ER nurses will at least have experienced one day in our life. And we can only be hopeful that it's a very busy day at St. Peter's that day, and that they have to stand in that hallway next to us while we're longingly looking for a stretcher or a cot for our patient. But that's a pretty exciting thing. The certified instructor update was held on October 12th. Steve, do you know how many participants we got for that?
I want to say 20, around 20.
So that's a pretty good crowd. We now have got the MailChimp ALS email list up and running. That means that the region can now send emails to any all ALS providers. I would like to just suggest that now that we know this, that if anybody thinks of something we ought to be communicating, say it in the meeting, let Tim know. We're so used to not being able to communicate with all providers that we probably have written off many opportunities in the past. And the BLS list is being worked on. We may be one of the few regions in the state that will be able to actually contact our providers, and that's really exciting. And we should use that definitely to our advantage. I know that the staff's been out at some of the EMS council meetings. There is something going on up in Saratoga County, and I know that we have a few people here from Saratoga, and I don't know if you'll have any update for us. I'm sorry, not Saratoga, Rensselaer County, but that Berlin and Grafton are starting to work together on the possibility of the transfer of operating authority from Berlin to Grafton. I attended the Rensselaer County meeting, and the Grafton representative was there and said that it was a possibility. I don't know, Kathy, anything to add on that?
The Town of Berlin Town Board met a week or so ago and unanimously approved a transfer to the town of Grafton. I believe the town of Grafton is going to accept the transfer. They're just trying to work out the details of this.
Okay, so that will come to us relatively soon, but it sounds like at least there's a inside county solution coming to one rescue squad that can't continue, and that's pretty good news. And it sounds like the town of Hoosick Rescue Squad is also working on an ALS upgrade. Again, that's Rensselaer County. Kathy, anything you could tell us about that other than they're working on it?
Actually, reading this is the first I've heard about it.
Okay, well, so everybody here's got an early notification of that possibility. There we go. So lots happening in Rensselaer County. So the Rebo customer service survey has been circulated, and I would encourage all of you to make sure that you fill it out, and we should probably encourage Tim to Steve, maybe encourage Tim that it should be a second round or second reminder on the customer service survey. That's used to talk about the customer service metrics that are used for our small incentive compensation program. The incentive compensation funds can be paid out. The end of our fiscal year just passed, so when we look at our total return on investment from the fiscal year that just ended, and if those scores measure up, there's some incentive compensation out there for the staff. Lastly, we've got the audit engagement letter from the auditors. On-site work will commence in early December. I believe, PJ, this will be the second year we use this auditor, right?
I believe so.
So we have a new auditor. It doesn't make sense, at least in my view, to be looking at, we had an audit for many years and then we put it out because you should always put it out every once in a while. I don't think after 1 year it's time to do it again as much as we can continue engaging with we're with Marvin and Company now, correct? Or was that?
No, we
were with Marvin and now we're with
Teal
Becker and Chiamonte, okay. There's really only like two choices around here, so we'll be with Teal Becker, and they'll begin doing the site work. Okay, so Steve, anything else from Tim's angle on the executive director report?
I don't believe so, he
Okay.
didn't.
All right, cool. So from my standpoint, I've got two things. One is the 2019 Northern Eastern New York EMS Leadership Seminar, Friday, November 8th, from 8 to 4:30 p.m. in Clifton Park. We put this together with the council's backing when it was suggested that we work on doing an educational program in leadership training. And we have put some money backing it. A good committee has been working on it. I've been part of that committee. A few other folks from our region, Nash Alexander from our region, has been part of that committee. The only thing at this point that's lacking is participation from our region. We're doing this with the North Country region, up north of us, and I would say about 75% of the participants are coming from up north, coming down to Clifton Park. I will say that Scott Bowman has, Valatia Rescue has got a lot of people coming, but I think that represents a good chunk of our region's participation. So my appeal is that we put a good program together. We're bringing in a national speaker in Chris Celebero. If you could help us both to look at if there's anybody at your agency that would be a great participant for this program, or if or spread it, if you're the county representative, go back to your county and just make sure everybody knows about this opportunity. You can find it, we've sent out, everyone's got to have in their inbox both the flyer and the agenda. Tim has sent it out several times. So if I can just ask everybody help in promoting this. Registration closes November 1, which is I guess this Friday. I'm willing to bet if somebody registers the following Monday, we're not going to say no. We're up in the 50 range. We'd like to be a little bit higher than that, 60 or 70 people. It is a first-time program, but it does have good faculty and it's got good stuff. So I told that committee that I would really bug everybody tonight. So, all right. So the second thing is our Innovative Payment Task Force, and I guess the first thing I would do is ask, we have a bunch of our ET3 agencies or ET3 applicants here tonight. Anything happening other than you've sent your applications in and you're waiting? Do any of you have any sense of, did they, when you send them in, did they tell you when you might hear anything? Okay, everyone's laughing at me. Look, I have to ask the questions. All right.
The application was accepted.
Okay, all right, so the 4 applications from our region have been sent in, and we have no idea what will happen to them. Okay, well, that's, all right. Since those applications went in, the Innovative Payment Task Force did have a meeting here. About 10 or 11 agencies came to that meeting, I think it's actually 12. And we talked about the possibility of an all-payer experiment. We spent about an hour going around in circles and what's the first thing to do in an all-payer experiment, and then I think the consensus was that we have talked to some of the payers because there's been a meeting with CDPHP, there's been a meeting with MVP. Let's see if we can get them to put in writing or to respond to the specific question, will you do an all-payer experiment with us? So the group set about writing a letter, and a number of people contributed to the letter, Dr. McHugh, Dr. Daly, Carol, I think you did sort of the first cut at it, myself, and it's not 100% done because Dr. Broderick from Empire and Landmark said some suggestions. We have to reconcile those, but essentially we're going to ask for a couple things. Number one, will they pay for care at home? Number two, will they pay for alternate destinations? And the way we ask it for anybody in the insured population, not just for Medicare, not just for Medicaid, not for commercial, but if we come up with a program that does alternate destinations, will they pay for it? And we spelled out in the letter that the committee has worked with, and Dr. McHugh took the lead on this, on coming up with some criteria for who could be those alternate destinations, and those providers have said they'd be willing to do it. On the paying for the treat at home, again, the committee has come up with a list of what would be required in the telemedicine provider, and we have the telemedicine provider. And there's one more thing in the letter, Rob. Do you remember what it is?
The QI.
The QI,
Asking
yes.
them to pay for the QI.
And asking them to pay for the QI, which is having a semi-independent group that will be likely based at the REMAC or at REMO that will do QI for our alternate destination and our treated home patients, and asking the insurer if they'll put up the money to pay for that as a part-time person or a grant or a contract, so that we can take the QI out of being done by the specific providers of care. Well, the providers of care will do QI, but then it should be overseen by an independent group that can just make sure we are still sending the right patients to the right places. So that's the summary. Does anyone have anything else? Did I miss anything or anything else? Rob, Carol, Dr. Daly?
I think the idea of making sure that there is somebody looking across all the payers and all the processes to make sure that it's being done well. Because any one component of this could end up becoming a problem for multiple payers before one payer discovered it. So having a, if you will, non-denominational quality assurance program moderated through here makes the most sense. It's what we're tasked with on regular EMS, and it's something that when we're doing a brand new project with new players, we've got to make sure we're doing it well.
Right. Okay. So, Alan, anything for, or Pat, anything with Clifton Park? Steve, Empire? No, okay. All right, so that process will continue to go forward. We do not have another meeting of the task force scheduled yet. Probably we should try and meet again before the end of the year after that, but I guess would you guys agree that that meeting should happen after the letter is sent and after we hear back? So hopefully that letter will go out in the next couple days after and maybe Steve, if you can just prompt Tim to make sure we get the work of Dr. Broderick integrated with the task force, And then we also once that letter goes out, as soon as we hear back, we schedule the next meeting of the group. That would be great. All right, cool. All right. Actually, there's one more thing to mention of the chairpersons, and that's the linen. We've all sort of adapted, I guess, to the linen situation. Albany Medical Center has now put in a different style of blanket, but there are blankets at Albany Med. They're a little bit coarser, but they're full size. We're all using the disposable sheet packs. St. Peter's has not yet made any changes in the linen policy, and I spoke to Dr. Bosco at the banquet and basically asked him very nicely to hold off a little while longer until we could have some more discussions. But I've heard from folks at both Ellis and Saratoga that they're under pressure because their linen is starting to walk out the door because of this. And so I finally was able to get a hold of Dr. McKenna at Albany Med last week. However, he was in the middle of a joint commission survey. But Dr. McKenna has committed to, he said, I'm not the expert on this topic, but he's committed to having a discussion. As soon as I can get a hold of Dr. McKenna, we will talk about bringing something together regionally for having a discussion between really the two major providers. But if Albany Med goes in one direction, Saratoga and Columbia Memorial, I mean, they'll be somewhat aligned with that because they're in one system. And I think that I'm guessing that Ellis is not going to, since Ellis has not been the one that initiated this, if there's a regional solution, they'd be willing to be part of it. But the one thing that we're going to have to brainstorm here is if there is a regional solution, the hospital folks are telling me that stuff is starting to, I mean, stuff walks out of there in big stacks. And so the question that we're going to have to grapple with here is how are we going to discipline ourselves, and that means not ourselves figuratively, but our employees and our EMTs. If it's a one-for-one linen exchange, how are we going to discipline ourselves to really make it a one-for-one linen exchange? And I don't think anybody is really upset about the person that takes an extra sheet, and so you have 2 sheets on your stretcher instead of 1. But I think that, I mean, I see it myself. Someone walks out with like 6 sheets because their ambulance is out and they're refilling it. And, you know, can I use Saratoga as an example? I mean, Anne Marie says that by early in the morning some days, that entire linen cart is gone. And she's under pressure too. So, any ideas about how we can deal with that? I didn't expect a lot of comments, but so I don't have the answer. I don't have the answer either. But look, we are charged with the responsibility. If we can manage to get the hospitals to come to the table and come up with something, we have to take some ownership in making it work.
I think if there's a regional solution, it'll kind of sort itself out. As of right now, you can get what you want here, but you can't get it here, so you're just going to take what you want from where you can get it.
Right. Well, so.
Pretty soon all the doors are shut and then we're
Exactly.
Right.
Exactly.
Right, Alan?
Lock it up and just
I
do
don't know,
one
I'm
for
pretty
one.
simple-minded, but what if there was just bins for each hospital, at each hospital, and we could deposit back each hospital's linen in their bin?
Well, that's kind of not the craziest idea in the world. I mean, one of the challenges right now is that St. Peter's and Albany Med's linens are 2 different colors. You know what's what. And if it was separated and returned, I mean, that's part of what we'll talk about with them. But that may solve part of the situation. It's not going to solve the situation of people walking out with stacks. And
You have to have one of those dispensing
Don't make it
machines
available.
where you have to put in a code and get that.
well, those are all good ideas, but I think we're just going to have to figure out among ourselves how we can get tough with our employees and our volunteers. And it means those of us around the table that have these employees and volunteers is putting some teeth behind. It's not like you can't walk out with a boatload of linen. So we'll have to brainstorm more on that, on that. Okay. All right, so we have nothing listed under the issue discussions tonight. Is there anything anyone wants to bring up? Okay, so, Mike, there's something Mike wants to bring up. Okay.
Of course, there's something.
Awesome. Well, medical director's up next anyway, so.
Okay.
You can just go.
That's perfect. Well,
Go.
the first thing I want to do is actually non-medical director related. So we've talked for a long time about creating an opportunity for people to get gear that says Remo and brands us better.
Okay.
So conversation with Tim probably about a month ago. Hey, how are we doing on the web portal? Nobody had had an opportunity to set it up yet. I was talking to the people at Awards by Walsh, who has set one up for Albany Med. And I said, what would we need to do to set one of these up for Remo? And she said, well, send me a logo. And I said, okay. So in your email right now is a flyer with the web portal for Remo gear. There's a subset of clothing that's available. The titles that are available for you include Remo Paramedic, Remo Faculty, Remo with the Regional Emergency Medical Organization underneath it. One that we didn't put on the web portal because I didn't want it to be out there for the world was Remo Regional Council. So if you would like something that says Regional Council, a shirt or a sweatshirt or a jacket, you can order it through this. This portal will be open for the next 3 or 4 days, and then a new one will be open after that. And it will provide an opportunity for people to have branded gear to here. If you want to have something that says Regional Council, that's something let me know about or let Steve know, and that way we can tie an order together to that. With that, what I would like to ask this group for, because I think both Jim Stairs and Steve Retzloff would be very disappointed if at some point in the meeting I didn't ask for money. What I would like to do would be get each of the folks that work in the office here a new something. Be it a sweatshirt or a vest or new shirts, because the ones that they have are a little long in the tooth, and it would be nice to start a process of having this web portal open on a regular basis with the staff here having access to that. So that's my thought right now. I did not calculate out what it would cost for one piece of gear for each of the people in the office. Steve, how many people in the office?
Oh, there's 3 of us all the time, Dave, Tim, and myself, and then Courtney, JC, and Rich, so 5 altogether.
And then the 2 people in QI, right?
Yeah, Deb and Jess, so 7 of us altogether.
Mm-hmm. So 7, and then how many teach in the classes here on a regular basis? 2, right?
Frank, JC does 1, so I guess he's already in there, so Frank, 2, 4.
So 4, so a total of about
9 or 10, I'd say.
about 9 or 10 people, with gear being somewhere between 20 and 50 bucks a pop. I would say if we could do $600 to allow staff here to get one piece of gear with this, I think that would be great in terms of branding and everything else.
Is that in the form of a motion, Dr. Dale?
Yes.
Okay, we have a second. Is there any discussion? All right, the motion is to allow the executive director up to $600 to purchase Remo branded gear for the staff. All in favor?
Aye.
Any opposed? Okay, any abstentions? All right, the motion carries. Steve, will you let Tim know that? Because otherwise he won't know it until he reads back the minutes.
Yep.
All right, so,
Just as a comment on the motion,
yeah.
Steve and I fully support that, and it's PJ that actually has to find the money that Dr. Daly has spent.
Well, I will admit though, I got to see your face when Dr. Daly mentioned your name, and it was one of surprise.
The thing is, they asked what I was handing out, and I was handing out something that wasn't going to cost Remo any money, so I needed to come up with another pathway to make sure to occur.
So
just so you know, as I was scrambling here, trying to figure out where we're gonna put this in this year's budget, Dr. Daly has just spent 30% of the miscellaneous money for the year 2020.
Wow. All
How
right,
much is
well,
left in the medical director's line?
It's his gift.
There wasn't a joke.
all right, so, now, so just let me, so this web portal is only open from now until, it says November 23rd.
No, this initial web portal will be open from now until Wednesday or Thursday of this week.
Right.
It will then close and it will reopen. They have to close it to then send it to get printed, and then,
Okay, so it's gonna be so they close it to batch it and then they reopen it.
exactly.
Okay, so do we need Tim to send out to all the agencies that this, or all the, to people that this exists essentially?
The staff,
Well, are there others other than us that wanna buy things off of this?
the only other people that would make sense immediately to send this out to would probably be to the REMAC and the academic committee as well.
Okay, so we should send web portal to REMAC,
It's already been sent to everyone that's normally here.
Yes.
Remsco,
It's been sent to this group and most of the office staff. I don't know if I did everybody.
okay. All right,
Steve,
well,
if you can make sure that the core instructors have gotten
yeah,
it.
okay, cool. All right, thanks. Well, that's great. Thank you, Dr. Daly, for sidelining and haberdashery. We appreciate that.
Sidelining and haberdashery.
And so we should, what?
Stars?
I took, one of my children to study the SATs. I have big words down. Also, we've already done this, but we should just acknowledge that Mike got the EMS Director of the Year award presented to him in New Orleans last week at EMS World, which was a very nice event. Also, this past weekend, Nash Alexander and Wilton EMS accepted the EMS Quality and Safety Award for the state, and Sheriff Craig Apple of Albany County accepted the New York State Weber Award. Our region is well represented in the statewide award winners, and so I think that we should probably ask Steve, if you could ask Tim to see if he can track down some photographs from the event from the state. I know the state had a photograph of it. Maybe he can take a day where he profiles like, Wilton EMS, pick another day, profile Sheriff Apple, and just put some stuff up there from the vital signs. That would be really nice on our.
Do you want that like on the website or Facebook or both?
Whatever, whatever you use social media strategies.
Okay.
I mean, Facebook seems to be nice, website would be fine. So that, and big news, next year's Vital Signs will be in Saratoga. That was the big reveal. They got 1,000 people in Buffalo, which is the best attendance they've gotten in Buffalo. Buffalo put on a good party. We drank a lot of pictures. Well, move on. Buffalo put on a good show. A lot of changes in Vital Signs this year, and I do want to compliment the Bureau of EMS staff. They put in place a whole new leadership track, a lot of new speakers, a lot of new features. I thought it was a very smooth running meeting. The fact that it's going to be local next year gives us an opportunity to get more of our people perhaps to go to Vital Signs. So it'll be in Saratoga, it is going to be on Halloween weekend. And I don't know what opportunities that presents for us as a regional council or as just a region as a whole, but having it come here. And I don't know if Clifton Park EMS, you knew it was coming to town or not, or is this a surprise to you, or?
We weren't aware of it, no.
Okay, so it's gonna be in your backyard, so it's kinda cool that it's coming here, I guess, and, that's kinda cool. Okay. All right, medical director's report.
Couple of things to let you know about. I was actually at a stroke meeting last week. It's been quite the month of meetings. It's in Chicago, New Orleans, and now Boston. The stroke meeting in Boston last week offered a lot of opportunities for us to look at how other stroke systems of care are working. For those of you that are interested, the REMAC meeting in December will focus on stroke. We'll bring some of the data in and we'll take a look and see how we're doing with the FAST-TD score of greater than 3 and whether this is the best score that we should have and whether or not the time and distance that we had factored into the original planning is making sense, or whether there's something else we should work on. But stroke systems across the across the Northeast are pretty interesting in how they've been set up.
That's not me, just for the record.
Scott? Oh. So, what I distributed to everybody as Remo Advisory 2019 -XX with, as pointed out by one of my astute editors, as the wrong address by 2. My apologies. Is a leave behind naloxone program for overdose treatment. I spent some time today on the phone with the medical director for the Philadelphia Fire Department. They've been doing a leave behind naloxone program for approximately the last 2 years with very significant success. This came to light because of a provider who thought about the idea of doing leave behind naloxone and in fact did, but realized at the same time that he had absolutely no standing to do so. We do have community access naloxone programs. We're available to give naloxone out to members of the community. So what this program will be is the opportunity for our providers, when they see the opportunity to intervene in the life of somebody who has opioid use disorder, gives them the opportunity to act then and leave behind naloxone with some just-in-time training for cases where they're afraid there might be an overdose. It doesn't have to have been an overdose. They could be in a house for something completely different and then realize that there are people there abusing opioids, and then do some just-in-time education and drop off the naloxone. It's being done actually across the entire state of Pennsylvania, and I think it provides a great opportunity for us here in Remo to offer one more way for us to save lives. So I'll look forward to working with Mr. Welge and Albany County, as well as PJ has already had some conversations with me, and
From
Anand's going to help us
Cancun,
out
by the
with some of
way.
the education. What's it?
From Cancun.
Well, note that I didn't bother you in Cancun. You chose to bother me from Cancun. And I must say that while I was driving into Boston talking to PJ, he definitely had the better side of that deal.
So is this being considered as a mandate that agencies must do this, or that agencies can do this?
Agencies can do it.
Okay.
Agencies can. They do not have to. They may participate if they choose. We'll just make sure that we've got some discrete rules and then opportunities for everybody.
Both ALS and BLS?
Yep.
And so what's the next step of this?
Next step is just for me to finish up a couple of little things. I've talked to Keith Brown from the Catal Foundation. Keith is going to assist us with putting together a one-page handout that will go with naloxone to offer people resources to turn to. We'll have a couple of QR codes on that page that will allow linkage to videos to do some training.
Right.
And this will be as comprehensive as we can get it.
So it does not need to be voted on at the Remap and
This is
Remsco?
all
This is
informational.
we're just gonna do this as soon as you're ready?
Yep.
Do we email you the page of questions we have regarding this?
So are there any questions for Dr. Daly today, or shall we email them later? All
I'd
right.
just like to make a comment. I think it's a very proactive program and it's great. But I did talk to Dr. Daly a little bit about, I wish that maybe we could expand it a little bit. In Columbia County, personally, we basically have a couple of BLS first response agencies that actually know the community. They know the opioid abusers, and quite frankly, would probably be more effective in leaving behind a kid because of the personal relationship versus, you know, a medic that we have coming in from East Jesus or wherever that doesn't know them at all. And so that maybe as the program goes along, we could expand it to that.
I think expanding it in specific cases based on specific reasons would make a significant amount of sense.
Because they're arriving 8 to 10 minutes ahead of the agency.
Dr. Daly, do you think that there would be any possibility of obtaining grant funds to pay for those kits for any place that Remo could like apply on behalf of the regional providers to receive?
Well, we already
Funding.
are a part of a community access naloxone program through Remo.
Okay.
So Tim has actually already ordered additional naloxone to support this.
Oh.
Through that. So the cost of the naloxone itself will not be borne by the region. It's by the region. Keith Brown from the Catal Foundation and I have already been in conversation about other potential local partners in this, and we'll keep you posted.
So it's possible that if an agency uses naloxone, leaves naloxone behind, that Remo might be able to resupply them?
Oh, no, that's not a possibility, that's absolute.
Oh,
Yeah, that part's absolute.
is that in the memo?
Yeah.
Oh, cool, I haven't had a chance to read it. Okay, awesome. Well, that's great,
And if
thank
it
you.
isn't, that's something you
It's
should.
not in the memo, here's one of my questions.
So everybody write, no cost to agency on their memo.
And will there be a list of where they
While
can
you're
get it?
crossing out 1653 Central Avenue.
Mike, is there gonna be, instructions on how to get a new one once this one expires or is used?
I'm not gonna include instructions based on the expiration date, but if it's used, absolutely.
Cool. Well, that's great, thank you, Mike. Anything under medical director? Anything else under medical director? Okay. Okay, REMAC report. Dr.
Remap,
McHugh.
not a heck of a lot. We did a lot of motions to make everything for ET3 run. Also, one thing is with the state's hesitancy in letting anyone transport blood. The feeling now is if you're going to need to transport with blood, just transport with blood. And worst case, the state will say you shouldn't have done that, you say sorry.
Okay.
Since we only have Empire who is now allowed to transport with blood. So you're still gonna have to take a nurse,
Right.
but the state really doesn't have any teeth behind, don't do that.
Okay. So we're,
Well, it's not a good way.
but, so we're, what's the progress on the state coming up with a new, better process for us being allowed to? Or is that just not happening?
Not much further, but talking to, what's his name?
I missed that, I'm sorry.
The trauma director at Albany.
Oh, Kurt Edwards.
Critters, I knew there was a K in there. He's looked into it, and the only thing people have had is they've had a letter from the state saying, you weren't supposed to do this, but there's nothing behind that letter.
Okay.
And rather than interfere with patient care.
Okay.
So the state actually announced that there's gonna be some regulatory reform around allowing agencies to transport blood. Announced that this was all gonna be forthcoming, and we have not yet gotten that process sent to
Okay.
anybody that I know of.
Well, at the national level, we met the folks from the EMS Agency of the Year in San Antonio, Texas. They are giving blood in the field. Their paramedic units actually carry blood and give blood in the field, so we have a lot of catching up to do.
Yeah, we're the only state that the helicopters don't carry blood. So,
All right.
that says a lot.
Okay.
And the only other thing is we had a pretty round discussion about psychiatric issues, which ended up being more discussion about hospital to hospital than pre-hospital to hospital.
Right. Okay. All right. Treasurer, PJ.
Okay, kind of excited this time because this is kind of our year-end report. For the first time, I think, in quite some time, we've kind of matched this up with our budget. We also have our training report associated with it as well. So if you turn to page 2, you'll see that we had budgeted $348,000 in income for the year. We hit 364, so that's pretty doggone close. The difference being is that we appropriated $60,000, or we used $60,000 out of our fund balance, where we had budgeted about 40. If you remember correctly, it was because we were waiting for the EMS course to be reimbursed. So if you look all the way down to the bottom, it says total profit or loss. you'll see that we had income of $37,429 over total expenses, and we had budgeted $31,887. So we're pretty much on target with that. If you flip back to page 1, you'll notice that on the top line, the operating cash of $91,000 versus $66 a year ago. That's because we did get reimbursed from the state. So essentially, as time goes along, we'll have to make another decision if we want to put more money into investment or not, and that'll be up to the finance committee itself, if we want to replenish that. The last page is actually, if you remember what we were trying to do, we were trying to figure out, was our training paying for itself, or was it, are we awarded, man, too much Cancun. Were we operating at a loss? You'll see that after all the income was associated and counted, and all the expenses, which included all the instructor expenses, that they added a profit of $26,000 into the organization. So last year in the budget, we appropriated the $39,640 towards the fund balance. That may have to be used as operating expenses in the upcoming year, which we approved at the last council meeting. That's been reduced to 11. And if you remember a couple of years ago, we associated that was going to be about $100,000 that we may have to use to get this program started. So again, we're absolutely trending in the right direction. I think we do have control over our expenditures, except for Dr. Daly. But you can strike that from the record. But I think we're trending in the right direction, and hopefully this report will give you some idea where we are relative to income and projections and expenses.
So the bottom lines are, our training programs are earning more than they spend, they're profitable.
Yes.
And that is subsidizing the overall region. And overall, our entire year-to-date budget, when you add up the training and everything else, we were in the black.
Yes, but remember, okay, we did take 60,000
Right.
out of our savings. Okay?
Right, but that was a
We had
plan.
37, so in reality, you know, we've still pumped in about 23,000
Right.
in cash to keep things moving.
But
But it's a lot better than 100.
That's very
we were
small.
looking at a couple of years ago.
And when you look at our balance sheet, our actual cash, we're ending the year with more cash than we began, with more total assets than we began.
Well, total cash. We have total investments that are about the same when you take our total cash from a year ago.
Right.
And compare that to our total investments this year, because we did move money
Right.
into our investments.
Okay, got it.
Okay?
Okay,
And our
thank you.
total equity is down about
And
$26,000.
our total equity is down, and that's the total liabilities and equities at the bottom of the first page.
Right, and that's down about 26,000, but
Got
that's
it.
the 20-some thousand that we've used to keep this program going.
Right. But
So
if we,
it's still an efficient use of our money.
right. And if we look at our total cash and equivalents and total investments, that adds up to over $500,000.
Right.
So fiscally, that's $20,000.
Fiscally, we had that 20-some thousand dollars to break even. But we're doing good, we're
We
trending
did
in the
well.
right direction.
Okay, awesome, thank you. Are there any
Dave's
questions?
aware of it, Tim's aware of it,
Right.
we worked hard on this.
Yeah, I think Jim has a question or comment?
Why is our instructor cost down over last year? I know our profit is up. It seems like we have less instructors. We need to do something to support more instructors. What's the breakout of that?
I can't answer that, you'd have to ask Tim. This is,
I guess that's what I'm kind of getting at. Are we overloading our instructors? I mean, they're bringing in more money, so they're obviously doing more work, and we're paying less for that. I mean, that's from a business.
no, you're saying the instructor cost is down, correct?
Yes.
Well, the real problem is, quite frankly, is that $89,000 from a year ago, we're not totally sure what was in that number. This year, we struggled to define that number as to instructors themselves historically, there may have been a QI coordinator thrown into there.
Okay,
Dave was not able to separate that out.
okay, so next year we look at it.
Should be apples
we
to
can have a
apples.
better- Okay,
Yep.
thank you.
Well, I want to thank PJ. He spent a lot of hours, even though the sheet looks the same in a lot of ways, what's behind these numbers is very different now, and we can understand. We can understand our profit and loss for the first time in a long time, so thank you for taking that effort. Okay, QI staff, and I assume, Steve, no report. I know the next meeting is December. CON committee, Jim, anything you know other than that there's this coming?
Yeah, it's, we had hoped that perhaps we could have this for you, but the state has yet to reply, so it'll be a November action.
Okay, there are no disciplinary actions to share tonight. Course applications, for your information, we have one in Saratoga County and one in Schenectady County. Correspondence from the state, a notification from DOH that Berlin Volunteer Fire Rescue has been placed on notice of not responding to calls. I think we've already addressed that. Notification that the town of Lexington Fire Company surrendered their ambulance service certificate has been approved to operate as BLS first response. Does anyone know where the town of Lexington is?
Southern Green County.
Southern Green County, okay. All right.
Almost.
Notification from Remsco delegate Skip Bernitz from Remsco County, he'll be resigning his seat on the council due to other commitments. So we have another, so we filled the seat this month and we have another open seat. So we still have, I think, 6 open seats, and Lynn's not here tonight for us to ask about where things are in the membership committee. All right. The committee reports, the executive committee has not met since the last meeting or had any conversations. I've got no report on the finance committee side, and the EMS council has not met since the last meeting either, so I have no report there. Anne Marie, on nurses?
Nurse committee has not met, but I sent out an email today, trying to see if I could get a date and a place for our next meeting. I'm hoping for one in November.
Okay. PJ, anything on MCI?
No, no report.
Membership, there's nothing because Lynn's not here. So Maria is not here tonight, but Maria did say she would be willing to chair the nominating committee and for this year. And it will be almost nominating season, so we'll have to catch up with Maria online to prepare us for the 2020 elections. The awards committee, Brian is excused tonight, but I'm sure all he would have to say is, wow, I don't have to do anything for a couple months with this because we just finished the cycle. Nice job by Brian. I don't believe we have anything from the bylaws committee. Dr. Daly?
Sorry.
Go ahead.
I knew there was one other thing that I needed to talk to everybody about, and I need to apologize. So the protocol rollout was less than stellar and simple, for a whole lot of different reasons. But the apps have now been updated. So the Android app reflects the protocols that everybody should be following, so does the Apple app. It seems that we've got a little bit of a problem with the Apple app. The search function doesn't work. It seems like the search function has probably actually never worked, and nobody ever found out that it didn't work.
Always been garbage.
Yeah, unfortunately, no one ever told us about it not working until I went and searched for stroke and found many, many things that came up, with the sole exception being stroke. So I'm going to work with Tim later this week to figure out the best solution for this. It actually gets a little bit complicated, but hopefully not very expensive. It's a little bit more difficult than just pushing out a new app or an update to this app, unfortunately, because some changes in Apple policy. But if you happen to hear from anybody that the Apple search function doesn't work, sadly we know after last week when I was sitting in a stroke meeting trying to use the search function by stroke. So anyway, we will deal with that. The Android search function works very nicely.
The links, as of
So-
yesterday, the links in the Android app did not work.
It didn't, okay.
So,
That was yesterday, I don't know if that's been updated.
Pull it up and show me. Oh,
One of my other
you're not an
guys.
Android person?
No.
Okay, all right.
so since you brought it up, I still don't understand this. So the state has now, and we've now received information that we can watch the state learning management system material and then get a state certificate that we took it. I also thought that there was the alternative possibility, which is watching the Remo physician update, and then you could log into the learning management system and say, I watched the Remo update, so therefore I'm not doing the state update, but I'm done.
Right.
Has that happened yet? Because I tried to figure out how to do that, and I can't.
If I understand it correctly, from when I was working on it yesterday, there's 2 courses in the state learning management system that you can take.
Okay.
One of them is a 15-minute video of the docs from Vital Signs explaining that if you have an alternate way of delivering the protocols, you can take this 15-minute one and it'll give you a half-hour credit and log yourself with the state saying that you have completed it. If you're doing it independently, then you go on the second track, which is the longer one, and it's
Right.
the 6 modules of videos.
Okay.
So if you do it yourself, you just gotta do the one that's at least on my screen,
that
pops
was-
up on the
That's
left.
what we did.
That was my understanding as well. It wasn't so much as clicking a box saying I did it elsewhere. It was doing the shorter of the 2 videos. Yeah.
And then you still have to take the quiz.
Yes, it's a 20-question quiz at the end, proving that you did it, and then registers with the state as having completed it.
Okay. Do all agencies understand this?
Doubtful. The communications have been poor since the
So,
beginning.
so is there anything that this region should do to better explain this?
Yes.
Okay. All right.
Jim has actually just explained it better than anybody else has before and seems to have found the only way around it. We just need to do a better job of actually finding out what this is and then getting that
Okay.
information.
So Steve, can you put on the list of things that we'd like Tim to do is, I think a memo from, would everyone agree, a memo from the executive director that definitively explains how to use the 2 different pathways would be helpful? Is there agreement on that? Okay, and since Jim explained it, maybe Jim you can even ask Jim, but, okay, so we need a memo from the executive director on 2 protocol update pathways. All right, cool. All right, county reports, anything from Albany? Columbia?
Columbia, we do use ODMAC extensively in Columbia County. This past weekend, we have a threshold, a spike threshold that would alert people, and our spike is 2 overdoses within a 24-hour period. And this past weekend, we had 7 in a 48-hour period. We use the
Both counties?
No, just Columbia.
Just Columbia.
And we do use this, Sheriff's Department, State Police, EMS, everybody goes through the 911 center. There are centralized data input, and it's real-time information. And once we hit that spike, that information is disseminated to all the agencies. So therefore, when we used it this past weekend, we were able to move resources into the areas that were being effective, both police as well as EMS agencies, as well as first responder units, to make sure they have enough resources to deal with the situation. So it's been extremely helpful to us. I'm sure it saved lives.
Wow, pretty cool.
Yeah,
It works.
It worked. All right, Green County. Rensselaer.
On the same ODMAP topic, in the past, our county has, our health department has tried to roll it out, and we all kind of worked on it independently. The agency I'm with has had it in effect for months. But now Rensselaer County is trying to unify and do it under Rensselaer County and have all of the agencies kind of cooperate under Rensselaer County. That was just rolled out a week or so ago, so we're trying to work with that, especially with some of the smaller rural agencies that have not gotten on board yet. And also, Rensselaer County as a whole, per the county executive, is pushing the concept of United Concierge to allow agencies, as you were talking about, ET3, to treat it home. We are not doing transporting to alternate destinations, but treating it home. So we're just beginning to get the ball rolling on that. A couple of agencies are getting on board, and we're trying to spread it throughout the county. So we're starting something new. That's about it.
Okay, thank you. Saratoga?
At our last meeting, we did have some representatives from Public Health come in just about the importance of flu shots and how we can track our members who've gotten flu shots.
Cool. Schenectady, Jim?
No report.
Okay. All right, so, we have one item for new business tonight, and, that is the purchase of a Polycom conference phone. That is those big star phones that you put in the middle of the table that can pick up, people all across the room. Our last meeting of the, one of the task forces was somebody's cell phone in the middle of the room, and, that wasn't that effective. So, we'd like a motion to have Tim purchase a Polycom speakerphone. I think Jim is making the motion. Do we have a second?
Second.
Scott, second. Any discussion? All right, all in favor? Aye. Okay, so we will have a new Polycom speakerphone soon for conference meetings. Does anyone have any other new business? Does anyone have any old business? Do we have any items from the floor? Okay, our next meeting date is November 25th. And if anyone, no one has anything else, motion for adjournment.
Motion.
Second? All right, all in favor? Aye. Thank you. Have a good night.